Happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick. I am an ER doc at Valley Presbyterian Hospital in Van Nuys, California.
Yes, and we're going to have a good talk today about something that I've been really interested in. I've had a lot of questions about from my patients. I'm not sure if many people have asked you about vitamin D deficiency, Dr. Ostick.
They have
in
not.
The ER.
Not in the ER, but I do want to say before we start that my gear today was because I came off the links, taking up golf as a nice socially distanced activity.
Good for you.
Yeah, I'm just trying to, self-care, self-help, something a
shout
little
out
bit
to-
active. Go Irish.
Yeah, Notre Dame with their first win this past weekend. Also, we're featuring a new painting by our youngest for our art teacher, Chris Lincoln, out there at St. Mel. It's another Pollock-inspired masterpiece. Anyway, we'll get that out of the way. The last thing you want to mention is, in order to get this video out to more people that want to know more information about our practice, about direct primary care, and all things COVID, we are going to give a $100 gift card to a randomly selected person that comments or shares our video. And we really appreciate you guys watching this and sharing this information. And we really hope that this is useful. A lot of my colleagues and mentors have done the same thing through this pandemic. And I think it's been a wonderful way for the medical community to come together to provide much needed information that's consistent and clear, that's guideline based and evidence based, and that there's not, when you go on social media, you can get mixed messages, and I hope this provides some transparency.
And we're going to do a local restaurant, $100 gift
Yes.
certificate, so that we can support small business. Restaurant business especially has been hit hard with the COVID pandemic and the shutdowns that have come.
And then the
along
fires
with it.
locally too have made it hard for them to be eating outside. So let's get to it. Vitamin D deficiency and COVID. There have been some recent reports about a strong correlation with people being admitted to the ICU with a more debilitating case in more severe cases of COVID-19 and associated low vitamin D levels upon admission. You're probably not checking those when they're being admitted from the ER.
That is not
That's
one of my
something
orders.
our lovely, smart hospitalists and intensivists are doing, as well as a ton of other markers to really understand the disease process better, to understand correlations. And so there's some early literature suggesting that people with low vitamin D levels do have this more severe course of illness. The question is, and this is where I get a lot of questions from my patients, does vitamin D supplementation protect me then from getting COVID-19, a more severe course of COVID-19? And that is something that we do not know. Vitamin D has had kind of a roller coaster ride of a life cycle in the past, I would say 10 to 15 years. When I was in residency, there were guidelines out that were suggesting screening everybody coming in for their physical, not just with symptoms, but everybody got a vitamin D levels screening check. And if anybody was deficient or insufficient, the recommendation was to supplement them, because there were early reports 10, 15 years ago that people with low vitamin D levels may have a higher risk of certain types of cancers, like colon cancer, cardiovascular disease, and then certainly things like osteoporosis and fracture risk in our elderly population. But what we have learned, there's been kind of a fall from grace with this vitamin specifically, because supplementing our patients with this has not borne out to really protect them from these diseases. And so what is going on here, and what we talk about a lot in medicine, is that's why we need randomized controlled trials and other good evidence, because we need to separate out what's correlation and causation. What is just a correlation? Is vitamin D suggestive of something else, or is it really the vitamin D that's causing these comorbid conditions to be worse, or COVID-19 to be a worse scenario? So vitamin D is kind of a complicated compound. It's a steroid hormone that has a lot of different metabolic processes and pathways in your body. It involves high levels of vitamin D improve your intestine's ability to absorb calcium. It also improves your kidneys, or decreases the excretion of calcium from your kidneys. It helps with bone metabolism. And all these things also are improved with sunlight obviously helps with the metabolic process with vitamin D as well.
I got some of that today.
You got some of that today, but in order to have a healthy level of vitamin D and an active level of vitamin D that's metabolically active and doing all the right things in your body, you also have to have a healthy liver and healthy kidneys. And so that's what the piece that is missing here is that maybe people that have low vitamin D levels, it's suggestive of other things. Maybe they have some chronic kidney disease coming into the ER with COVID. Maybe they, have some, fatty liver disease or other, types of comorbid conditions that is then causing their vitamin D levels to be low, but maybe it's not the vitamin D itself.
So let's cut to the chase. I mean,
Yes.
when people ask you, gosh, I heard that if you have low vitamin D levels, you can just take vitamin D and then you won't get COVID, so I don't have to wear my mask. If I'm taking vitamin D supplements, do I still need to wear my mask?
Well, absolutely. I mean, those two are not related, right? So masking is something that reduces the risk of spread to other people in the community, but also has some evidence has shown reducing the risk of receiving and getting the coronavirus if you actually wear a mask, even just a cloth mask,
Right.
and maybe decreasing that viral load, and so then that's decreasing the severity of illness that you may get. So masking has nothing to do with vitamin D, and unfortunately, supplementing vitamin D, if you have a healthy, varied diet, and you're drinking, this is why we ask all of our kids during their well child how much milk they drink, because we have fortified milk in this country for the last several decades with vitamin D to make sure kids get that vitamin D supplementation that they need so they don't get things like rickets and other metabolic bone disorders. So if you're getting a healthy diet that's varied and full of fresh vegetables and green leafy greens, and
you get outside every once in a while.
dairy, and you get outside every once in a while, your vitamin D levels should be sufficient.
Well, we're talking, just to clarify, vitamin D, you meant Dilaudid, right? Because I do give that in the ER. No. Okay.
No.
All right.
I know. We complement each other very well, and you will be very helpful when I need to put a chest tube in and no. But in terms of preventative medicine and all things family medicine and primary care,
I defer to you.
yeah. So vitamin D, do you need to get it checked? If you have symptoms of something going on, you should definitely talk to your doctor about it, but it is not recommended anymore for screening. And we're not really clear if supplementing vitamin D is really going to help, prevent other types of illnesses.
So if you're worried about it, talk to your primary doctor.
Talk to your primary
If
doctor.
you don't have a primary doctor, Dr. Amy Ostick, Health and Healing, DPC.com.
Yes.
You're up to, you are very close to 300 patients, and this practice is going to stop at about 400 patients.
Mm-hmm.
So if you've been thinking about it, if you're on the fence, sign up now.
Yes, please reach out. I'd love to talk to you more about the model. And even if you don't live nearby, I would love to help you find a DPC near you, because we're very passionate about this model and how it can transform primary care across the country. We all need better access to primary care. And yes, get your flu shot. We're here for you.
Flu shots are here. We got them at HHDPC. I got mine the other day.
Have a great weekend, everybody.
Thanks, Dr. Ostick. This was really informative.
Thank you, Dr. Ostick. Cheers.